Dr. Abner Crowe's surgical instruments were laid out on a plank table in the order he'd learned at Jefferson Medical College in 1843. Scalpel, forceps, probe, needle, catgut suture. The table was clean. Crowe was considered eccentric for insisting on clean instruments in an era when most frontier surgeons wiped their knives on their trousers between patients. The surgery was a single room in La Luz, New Mexico Territory, a town of 300 souls that sat in the Tularosa Basin between the Sacramento Mountains and the Jornada del Muerto Desert, a location chosen by people who liked heat and solitude and had given up on anything resembling civilization. Abner was 52. He had practiced medicine for 27 years, first in Pennsylvania, then in the Army during the war, amputation surgeon antietam, an experience that had removed both his squeamishness and his ability to sleep soundly. Then on the frontier, where the supply of physicians was thin and the demand was thick. If the story of how a frontier doctor and a Mescalero healer built a medicine empire from a single wound fascinates you, subscribe now. What this 18-year-old girl teaches a 52-year-old surgeon will change everything. They brought the Mescalero warrior in at dusk. Black Horse, 35, powerfully built, carried by 2 men from his camp in the Sacramentos, with a wound in his right side that told its story in blood and location. Cavalry carbine, approximately .50 caliber, entering below the ribs on the right side, exiting through the dorsal muscle without hitting the spine. A clean through and through, relatively speaking. The bullet had missed the liver, fortunate, missed the kidney, fortunate, and produced an exit wound approximately the size of a silver dollar, unfortunate. Exit wounds bled copiously and were difficult to close.
The wound was survivable. The surgery was straightforward. Debride the entry and exit wounds, check for bone fragments and fabric contamination, close with catgut suture. I had performed this procedure approximately 80 times during the war and perhaps 30 times since. The surgery was the easy part. The hard part came after.
Crowe operated. By lamplight, without anesthesia, ether was unavailable, chloroform was unreliable in desert heat, with Black Horse biting on a leather strap and making no sound that Crowe could hear, a fact that impressed the physician, who had operated on men who screamed until their vocal cords ruptured. The surgical work was clean. Entry wound debrided, exit wound closed with 12 sutures, cotton dressing applied. The hard part: infection. Every frontier surgeon knew the mathematics. Approximately 40% of gunshot wounds developed infection after surgery. Of those infected wounds, approximately half proved fatal. Not from the bullet, from the invisible contamination that entered the wound during surgery, during dressing changes, during the simple act of existing in a world that 1870 medical science did not yet understand was populated by microorganisms. Germ theory was being developed in Paris and Berlin. It had not reached La Luz, New Mexico. She arrived on the second morning. Little Antelope, Black Horse's daughter, 18, with a leather bag of plant materials and the directness of a woman who had been healing since she was 12. She walked into Crowe's surgery without knocking. Mescalero etiquette did not include knocking. A closed door was either entered or not, and Little Antelope had decided to enter. Black Horse's wound was already showing the early signs of infection: redness extending beyond the suture line, heat in the surrounding tissue, the faint ammonia smell that preceded suppuration. Crowe recognized the signs with the weary familiarity of a man watching a clock he couldn't stop.
I bring medicine for my father's wound. Not your medicine, our medicine. My grandmother taught me to make this poultice when I was 12. It prevents the rot that kills after white doctors sew.
She unwrapped a thick, green-brown paste from a square of deerskin, a poultice composed of ingredients Crowe could not identify, a mix of crushed plant material, animal fat binder, and what appeared to be mineral clay. The smell was astringent, sharp, medicinal, the smell of volatile plant compounds released by grinding.
Young woman, I appreciate the concern for your father, but this wound has been surgically treated with proper technique. Applying an unsterilized plant paste to a sutured wound is, with respect, likely to introduce contamination, not prevent it.
Your stitching is good. Your medicine for after the stitching is nothing. You close the wound and hope. We close the wound and treat. The poultice contains osha root. It kills the tiny things that cause the rot. Yerba mansa. It reduces the fire in the skin. Piñón resin. It seals the wound against air and dirt. These are not hope. These are plants. Plants that my grandmother's grandmother used. They work.
Crowe hesitated. 27 years of medical training. The formal institutional variety said, "Reject this." Plant paste applied by a Mescalero teenager was not medicine, but 27 years of practice, watching 40% of his surgical patients develop infections that his training could not prevent, whispered something different. Your method is failing. Hers might not. He allowed it. Little Antelope applied the poultice over the suture line, wrapped it with a clean dressing, and sat beside her father with the patient stillness of a healer doing the second part of healing, waiting. The wound did not develop infection. By the fourth day, when Crowe's experience predicted the onset of suppuration, Black Horse's wound was clean. The redness had retreated, the heat had dissipated, the sutures held without inflammation. The poultice, whatever it contained, had done something Crowe's entire pharmacopoeia could not. It had prevented post-surgical infection. Crowe investigated, not with hostility, with the genuine curiosity of a physician who had just witnessed a clinical result that contradicted his training. He asked Little Antelope for the poultice's composition. She told him, not all of it, some was sacred knowledge, but enough. Osha root, Ligusticum porteri, yerba mansa, Anemopsis californica, piñón resin, a clay base. He tested them. Crude tests, frontier-level empiricism, not laboratory science. He applied Osha root extract to infected wounds on other patients. The infection rate dropped. Not to zero, but from approximately 40% to approximately 15%. The numbers were not rigorous. The results were unmistakable. Grandmother speaks twice. Black Horse's mother, the woman who had taught Little Antelope, visited Crowe's surgery. She was 68, small, weather-creased, and carried approximately 4 decades of plant pharmacology in her memory. She evaluated Crowe's surgery the way Crowe had evaluated the poultice, with professional assessment.
Your cutting is good. Your sewing is good. You clean your tools, better than most white doctors. But you do not treat the wound after you close it. You close it and leave it to the spirits. We close it and treat it with plants. The spirits help, but the plants do not wait for the spirits. The plants work now.
Subscribe. When a frontier surgeon and a Mescalero healer discover that their combined medicine saves lives neither could save alone, the empire they build becomes a testament to what happens when pride yields to results. The partnership formed. Crowe's surgical technique, his cutting, his suturing, his anatomical knowledge, combined with Mescalero herbal pharmacology, their wound dressings, their pain management, a willow bark compound that functioned as a salicylate analgesic, essentially frontier aspirin, their antimicrobial preparations. Little Antelope became Crowe's apprentice, or he became hers. The question of who was teaching whom depended on the day. On surgery days, Crowe taught anatomy, instrument technique, the mechanical knowledge of how bodies work. On pharmacology days, Little Antelope taught plants, which desert species produced antimicrobial compounds, which mountain herbs reduced inflammation, which bark preparations managed pain.
You know the body, I know the plants. Your tradition cuts and sews. My tradition treats and heals. Alone, your patients get the rot. Alone, my patients cannot survive a bullet wound. Together, cutting and treating, surgery and plants. Together, the patient lives.
The synthesis was not warm. It was practical, the alliance of two traditions that needed each other, respect growing from results rather than from any philosophical reconciliation. Crowe did not adopt Mescalero spirituality. Little Antelope did not adopt Western materialism. They adopted each other's tools. Deputy Marshal Webb provided the proof. Brought into Crowe's surgery with a knife wound in his forearm, deep, contaminated with dirt, exactly the kind of wound that produced fatal infection in approximately 60% of cases. Crowe debrided and sutured. Little Antelope applied the poultice. Webb healed without infection. Webb told every marshal, every soldier, every frontier traveler he met. The practice grew. Not explosively, the frontier moved slowly, but steadily. Ranchers, soldiers, miners, settlers. Word spread that the doctor in La Luz and the Mescalero woman worked together, and that patients treated by both survived wounds that killed elsewhere. The army post at Fort Stanton began sending serious wound cases to Crowe's surgery, specifically because of the combined treatment. Little Antelope's vow, made at her father's bedside, watching Crowe's sutures and her own poultice work in concert, was specific: to build a practice that honored both traditions, not a white practice with Indian supplements, not a Mescalero practice with white instruments, a third practice, something new, something synthesized, something that did not exist in either tradition alone.
My grandmother's medicine saved my father from the rot. Dr. Crowe's surgery saved him from the bullet. Neither medicine alone was sufficient. I will learn both. I will carry suture and poultice. I will carry scalpel and osha root. The patients will not care which tradition saves them. They will care that they are saved.
She learned surgery. Crowe taught her. Over 2 years, starting with wound debridement and progressing to suturing, setting fractures, and extracting bullets. She was meticulous, steady-handed, and possessed of the particular calm that allowed her to work inside a screaming patient's wound with the concentration of someone threading a needle in a windstorm. Crowe learned pharmacology. Little Antelope and Grandmother Speaks Twice taught him approximately 40 plant preparations, their dosages, their interactions, their seasonal variations. He recorded everything in a notebook that became, over the years, the most comprehensive document of Mescalero Apache pharmacological knowledge compiled by a Western physician. By 1878, the practice, Crowe and Little Antelope, served the Tularosa Basin, the Mescalero Reservation, Fort Stanton, and every settlement within a 60-mile radius. The Medicine Empire was not a business, it was a tradition. A new tradition, born from the fusion of two old ones, serving everyone who needed it, regardless of race, language, or the particular system of knowledge they believed in. Legacy. Crowe died in 1883, quietly, in his surgery at his desk. Little Antelope continued the practice. She trained 3 apprentices, 2 Mescalero women and 1 white woman from Fort Stanton's garrison, in the combined method. The apprentices trained others. The chain continued. Subscribe. There's more Ranchers' Honor stories where two traditions collided and built something stronger. More frontier tales where the person who changed everything was the one no one expected. And more Chronicles where legacy was not inherited but created. Doctor's stitched wound of Mescalero brave. Daughter's vow built Medicine Empire. The empire was knowledge, surgical knowledge from Pennsylvania, meeting botanical knowledge from the Sacramento Mountains. An 18-year-old Mescalero woman saw what a 52-year-old physician could not. The combination was the cure. The wound heals because the scalpel cleans and the plant protects. The empire stands because the doctor listened and the daughter taught.